You feel that pop. Your knee just gives out. And fam, you've torn your ACL. But, the physical injury, that's really just the start. What comes next is this incredibly confusing high-stakes journey, and it's filled with all sorts of conflicting advice. So, do you go for surgery or rehab? Let's get into it and really unpack this huge decision.
Now, this quote, this isn't some made-up line for a movie. This is what a surgeon actually told a patient in a recent Australian study. And it just perfectly frames the problem, doesn't it? Is surgery really the only way to get back to an active life? This one sentence captures the incredible pressure patients are under.
So every single patient's story starts right here. In that instant the injury happens, you're not just dealing with pain. You're suddenly standing at a crossroads, staring down one massive question. What do I do now? And everything we're about to talk about, it's not just theory. This is all built on the real, lived experiences of 734 people. These are Australian adults who've been in this exact spot, trying to figure out their own ACL injuries. Okay, so after the injury, the hunt for answers begins, and patients find themselves bouncing around this maze of appointments, talking to everyone from their GP to physios, and of course, orthopedic surgeons. You're just hoping someone can give you a clear path forward. But getting that clarity, turns out, it's really tough, especially when you feel like you're on the clock. A theme that came up again and again in this study was that these super important talks with surgeons felt incredibly rushed, sometimes as short as 15 minutes to decide on a procedure that will change your life. And you can just feel the impact of those brief appointments in this quote, which comes straight from a patient. When you feel like you're not being heard and you're not getting the information you need, a doctor's visit can feel, in their own words, traumatizing. For a lot of people, the first stop is their family doctor, the GP. But patients tended to see this as more of a pit stop than a real consultation. The person who gets you the MRI referral or the appointment with a specialist. But what's really interesting is that even at this very first step, there was a heavy lean. The study found 65% of GPs were already presenting surgery as the top choice. All right, so if the advice from GPs was leaning one way, the advice from physiotherapists, well, that's where things got messy. Patients said the info they got was often all over the place. Sometimes one physio would say the complete opposite of another, which just made things even more confusing. So you've got these mixed signals floating around. But as patients got further into the system, a very, very powerful pattern started to emerge. And when it came to the advice from surgeons, there was a really strong push in one particular direction. And the data here just makes it crystal clear. I mean, look at these numbers. A massive 85% of surgeons told patients that surgery was the best treatment, and 84% said it was the best way to get back to playing sports. That's a nearly unanimous recommendation. It's huge. Now, with physiotherapists, you see a pretty similar story, even if the numbers aren't quite as high. You've still got a clear majority, around 61 to 62%, presenting surgery as the best option. So while it's not as overwhelming as the surgeons, the overall clinical advice is definitely tilting the scales hard in one direction. Okay, but this next number might be the most jaw-dropping one from the entire study. Only 10%, just 10% of surgeons told their patients that, according to the actual clinical trials, the average outcomes are similar whether you get surgery or you start with high-quality rehab first. Just 1 in 10 shared that key piece of information. Another thing patients felt was that the reality of surgery was often, well, downplayed. This person was told it was just like a little keyhole surgery. But as they found out when they did their own research, there was a whole lot more to it than that. The recovery, the risks, it was a much bigger deal. All right, so let's get into this because this is where the whole story pivots. We've heard what patients are being told day in and day out, but now let's look at what the best available scientific evidence, the stuff from actual clinical trials, has to say. And here it is. This is the disconnect, laid out side by side. On one side, you've got the common advice. Surgery's better. You need it for sports. It's risky not to get it. And on the other side, the evidence, which says, on average, outcomes are pretty similar. And get this, about half the people who really commit to rehab first end up not needing the surgery at all. That's a massive gap. And you can see how that information gap leads directly to some pretty big misconceptions. More than half the patients in the study thought surgery was the only way to get back to sports like soccer or basketball. And a third believed that skipping surgery would lead to more arthritis down the road. neither of which is really backed up by the research. So why does any of this matter? What's the big deal? Well, because at the end of the day, the goal isn't to say surgery is bad and rehab is good, or the other way around. The goal is to make sure every single patient has the power to be an active, informed partner in their own healthcare. And the solution is to move towards something called shared decision-making. And it's actually a really simple, powerful idea. It's a partnership. Your doctor brings the best evidence to the table, you bring your personal goals and what's important to you, and together, you figure out the best path. Your voice is at the center of it all. So the main takeaway here is really practical. It all starts with just recognizing that you have a choice. It's not a foregone conclusion. From there, it's about digging in, getting the pros and cons for all the options, and then having a real honest talk with your clinician about what you want to achieve. That's how you make a decision that's right for you. And this really brings us to the heart of the matter, and a final thought that goes way beyond just knee injuries. You see, just saying yes to a procedure, that's consent. But truly understanding all of your options, the real risks, the real benefits, and what the evidence actually says, that is informed consent. And the difference between those two? Well, it's everything.